That's right. November is Lung Cancer Awareness Month, and every day we are making strides to understand the disease just a little bit better. Here with me now is Dr. Thomas Varghese, a thoracic surgeon with Huntsman Cancer Institute. Thank you so much for being here.
No, thanks for having me.
Are so knowledgeable in this field, and more people than we realize do get lung cancer.
That is correct. In the United States, approximately 245,000 patients each year are diagnosed with lung cancer. And the more concerning thing is that most lung cancer, unfortunately, is picked up at a later stage. So approximately 155,000 people die each year from lung cancer as well.
And in Utah, we have so many other, I guess, extenuating circumstances with our pollutants and other things.
You're absolutely correct. Traditionally, people think of lung cancer as associated with smoking. But Utah, we have the highest amount of non-smokers in the nation, and so there are other factors here in Utah. For example, radon levels, the possible combination with air pollution, all these factors
also play. With mining as well.
Mining as well, absolutely. And so I think that there are certain factors within our environment here in the state of Utah that we have to be a factor in as well.
Especially concerning. So there are two different types of lung cancers?
That is correct. The two big broad categories are non-small cell lung cancer and small cell lung cancer. Small cell is less common. It's about 15% overall, but it's the very aggressive type that once it hits, it starts spreading to the other organs quickly. Non-small cell is 85%.
What are some of the symptoms we do need to watch out for?
Sure. Some of the symptoms include a cough that just doesn't go away, unexplained weight loss, a change in your voice, a sharp chest pain that you just have no other explanation for. These are kind of the signs, coughing up blood. These are the signs that it raises the concern that something's going on in the lungs. Unfortunately, though, a lot of lung cancers present with no symptoms whatsoever, so it's really increasing the suspicion that something is going on and initiating some screening protocols as well.
At Huntsman Cancer Institute, you guys have been in the forefront of some really groundbreaking research and treatment.
We have. We are very fortunate. We have a lot of clinical trials going on. People have heard in the news about new types of drugs such as immunotherapy. We have different types of advances in radiation therapy. Even in surgery, we have minimally invasive techniques. And so the fortune that we have in working in such a great environment is we have access to all the cutting-edge technology across the spectrum of treatments.
I think when people heard lung cancer, we would think that it's a death sentence, but there are more survivors now.
Absolutely. When I first started out in my career, it was pretty dismal news. I mean, we would try to do treatments, but especially in the last few years, the advances have really caught up. We have survivors, and I think that the key thing is that no matter what stage we find the lung cancer, we have treatment options for you. That our goal is to allow you to live the best life going forward.
And if there is, it's something that can run in your family too, right?
It can. Unlike other cancers where there have been definitive patterns, here it's if your first-degree relative, you know, let's say your parents had lung cancer, it just raises a concern about, is there something in the genes, or it could be also directly related to the environment as well.
And if there's ever a question, you can always get screened at huntsmancancer.org. You can find more information there. Dr. Varghese, thank you so much for being here and all the work that you do.
Absolutely, Parsa, and thank you.